Hi, everyone, and thank you for joining us here today on TIP International Radio. I'm your host, Leah Maston. We are showcasing prestigious top professionals from all industries all over the globe to share their experience and stories of success. We have a very special guest joining us today who is a world-renowned medical director of Wisconsin Stem Cell and OBGYN. She's an award-winning author and educator who empowers her patients to choose healthier options in order to let them live their best life. She is widely known for her practice of both traditional and non-traditional family medicine with an emphasis on wellness and preventative care. She was just recently honored at the International Association of Top Professionals, IAOTP Annual Awards Gala at the Bellagio Hotel for her selection as Top Medical Director of the Year. Everyone, please welcome Dr. Victoria Mondloch. Hi, Dr. Mondloch. Thanks for joining us today.
Thank you so much for allowing me to be a part of this show.
Well, it's absolutely a pleasure to have you on the show. Dr. Vicky, you have over 30 years of experience as a practicing physician and expert in women's health and preventative medicine. Tell me, what first got you started in this industry? Was it always a field you were interested in?
Well, it's kind of interesting that you ask. Initially, I really wanted to study foreign languages, and science was my backup go-to. And when I got to college and I couldn't get both foreign language and science in my class schedule, I decided to do the science first and then come back to what I knew best, which would be the foreign language, and I could get that in catch as catch can. Well, once I got into the science classes, I really enjoyed them, so I ended up getting my degree at Marquette University from a biology standpoint, and thought, well, okay, now that I'm done with a good grade point from a good school, I'll just apply to medical school. And you don't just get in just because you have good grades. The politics of getting into any profession still has politics attached to it. So I did a year of graduate school, got married, did research for 2 to 3 years, and then found the pathway to get into medical school. So,
well, you ended up on the right path, that's for sure. You're a best-selling author of Blossoming, Becoming a Woman, and Full Bloom. Tell me about these books and what drove you to share this with the world.
Well, I wrote these 2 books after being in private practice for 25 years. And what I realized is, like most things in Western medicine, women's health is not at all preventive. And the decisions that medicine makes about patients and women's health aren't even science-based. You know, when you go to the doctor, you actually, are going to ask a question. Your doctor's going to do blood work based on your question or your concern, and then treat you accordingly. Well, when you go in with an abnormal bleeding question, do they check your hormone levels? And I'm going to say likely not. Every patient that comes to me, when I ask them that question, they look at me with a kind of a funny look on their face and they go, well, no, they just put me on artificial hormones and tell me that I need to take the pill, and that if I have cramping, just take this pain medication, or if that doesn't work, when things get bad enough, then we'll just do surgery. It's like, well, wait a minute. Where's the science in that? There's no science whatsoever. And there's no educating of women why they're having the heavy irregular periods they're having, or why they're having cramping, or what they can do about it. So the when to do something is only when you've had it up to here. So there's absolutely no science to it. So why aren't we teaching women how their bodies work? And why don't we emphasize the idea of wellness? Gee, there's a concept, right? And why don't we introduce the idea of hormone balancing for wellness and preventive health? It's crazy. So I actually first wrote Blossoming, Becoming a Woman, because The adolescent female is truly the forgotten woman. Now I'm going to say that again for emphasis. The adolescent female is truly the forgotten woman. We dismiss them. Oh, they're just dramatic. Oh, when they have a question about their health, well, they just go to your room. Well, I didn't have that problem, so therefore you'll just outgrow it. Or, well, I had that and I did outgrow it, so, just deal with it. And we send our daughters to their room. And they're asking what is happening, and because we don't know how to answer their questions, because nobody answered them for us when we had the same issues, we just assumed, and we were told, you'll get through it. But you know what? Our daughters have something that we never have, and it's called the internet. And so in my day and age, I had to ask my mom, and it was mortifying, actually. I told my mom I had my first period, and I thought I was dying.
Oh, no.
I was bleeding. Oh, I was mortified. And I have 4 brothers and no sisters, so who was I going to ask?
Oh,
so
no.
I'm talking to my mom, and I said, I think I'm dying. And I showed her my underwear, and she just got a smile on her face, and she goes, well, honey, that's just your period, now you're a woman. And that was supposed to be my answer. So, we'll talk later. So she had bridge club at the house that night. And I overhear them laughing. And they usually don't laugh, so I kind of sneak, to the corner to hear what they're laughing about. And they're laughing about me. Oh, Vicki got her period. Oh, she did. Oh, isn't that cute? I'm like mortified. Mom, you're telling the neighborhood. How can I look Mrs. Smith in the eye from now on, It was just the worst experience. And afterwards, when I called her on it, she said, well, honey, we all get periods, so I don't know what you're so upset about.
Oh, my gosh.
Oh, my gosh, Mom, my deepest, darkest secrets,
Right.
But our daughters have the internet. So they get sent to the room, and they ask Dr. Google, what does this mean? And if you think about it, you go, well, yeah, I go to the internet for a lot of answers to questions, but these are answers to questions that nobody's giving answers to. So it's like the wild, wild west out there. What answer do you trust your daughter to read? What answer do you trust you to read? Right? So that's where they're getting their information. So you say, well, okay, we'll go to the pediatrician's office. Well, they're set up for a well child check and for getting young kids vaccinations on their journey through childhood. So when we go in with our adolescent daughters and ask about cramps, it's like the machinery comes to a halt, and everybody looks at everybody else and goes, we don't really do anything about that except put you on the pill, and then we'll send you to a gynecologist. Well, you just got dismissed by your doctor, right? They didn't answer your question at all. They didn't take you seriously at all. It might have taken you all this courage to actually get enough courage to ask that question, and then your doc just dismissed you. Wow. That's the one person I thought might answer it. It's the doc I trust, and now you're sending me to a perfect stranger? It just is unacceptable, and it happens over and over and over again. And because nobody is giving us any different answer, it's like Groundhog Day. You get up and you do the same bad thing all over again. And you hope for a different answer to the question, but you never get a different answer. And so you finally get frustrated and you stop asking because there's no good answer out there. But I beg to differ. There is a good answer out there. And that's why I wrote Blossoming. So it's to take away all of the myths and to answer and put forth all of the truths about what hormone and puberty and hormone swings, and put some sense to it. Put the symptoms out there. Let women and adolescents read about it. Read about it with their mom, and let their mom be an ally with them, not an adversary. against them as they go through these weird and changing wild hormonal swing times that we call puberty. And it's the same thing that happens to their moms in their 40s.
Right.
That's called perimenopause. So, like mother, like daughter, like daughter, like mother. So then I wrote the second book, Full Bloom, Perimenopause, Menopause, Postmenopause, and Beyond. And I see a lot of women in my day, and as an OBGYN, my patients were primarily obstetrical patients that then have continued to mature with me through my medical journey of being a doctor. And as I went through my own perimenopausal issues, I couldn't find a doctor to answer my questions. So I got to thinking, and I talked to my office manager, who was my best friend, and I made that comment, and she sat back and folded her arms, and she said, well, Doc, if you don't know the answer, how in the heck do you ever assume that your patients are going to find the answer?
Right.
And I thought, light bulb moment, she's right. She is absolutely right. If I don't know the answer, how can I expect them to know the answer? So I thought, okay, then let's put down everything that goes on with hormone swings, the same wild hormone swings that go on in our 40s, that then we think the curse is gone when we hit our 50s. At least that was always the term that was thrown at the menopausal woman. The curse is gone. Aren't you glad? Now you don't have hormone swings to deal with. But wait a minute, I'm puddling all over my bed every night. I'm getting up and changing my clothes 3 times at night. I can't get through a meeting without remembering the end of the sentence that I start. I'm having heavier bleeding than I ever had. And I'm skipping, and I have no control, and my PMS is out of control. And what is going on with me? And they just smile and go, well, you'll get through it. Well, wait a minute, didn't I hear that when I was an adolescent?
Yeah.
It's all the same frustrations. And again, where is the science? When's the last time a doctor said, let me check your levels and get your hormones back in balance? Unless you're in my office, it doesn't happen. So why is that? How can we be so scientific about every other area of medicine? You have difficulty breathing, they want to do blood work. You have a little chest twinge, they want to do blood work. You have a little acid reflux, they want to do blood work. I mean, my goodness gracious, you want to walk across the street crosswise and they want to do blood work on you. So now you present with a very specific recurring set of symptoms, and they pat you on the head and say the curse is going to be gone soon? What is wrong with this picture, right?
Right.
Right. So, you know, women have the blessing and the curse, if you will, of having a reproductive system that is going to need special care. We know that. We know that it's special. But yet, because of that, we suffer from multiple issues with regard to the ebb and flow, the beginning, the peak, and then the end of our menstrual career, which is a lot of abnormality with heavy bleeding, uterine fibroids, polyps, ovarian cysts, things like endometriosis, and those are all just physical things. Now we have actual emotional things like depression and anxiety and PMS, and throw a little mid-abdominal weight loss in there with a little migraine, a little hair loss, and cactus sex. Oh my gosh, where did cactus sex come from, right? And now our bladder doesn't even like us.
Right.
So all of that are issues that men don't deal with, but we do. And what are we given for advice You'll get through it. Where's the science? There is no science in there. But all of these issues that I just talked about are due to hormone imbalance. Therefore, by definition, they are manageable and preventable by hormone balancing. But nobody tells us. It's like this little deep secret that nobody can know. So that's why I wrote Full Bloom. Is American medical research only focuses on the Women's Health Initiative. Now, that study was started in 1995. Now, how many years ago was that, right?
Yeah.
And that study only looked at women on Premarin and Prem-Pro. Now, I've got a little surprise that you may already know the answer to this, but do you know what Premarin stands for? Pregnant mare's urine. Oh, horse pee and pregnant horse pee? Yep. And the Prem-Pro is take the same Premarin, but now add a synthetic progesterone, which actually is the culprit for the rise in breast cancer, heart attack, and stroke. That was the result of that study. Now, wait a minute, you go. How come we didn't study human-based estradiol and human-based progesterone, the two female hormones? Well, the Europeans said, we want to do that study too, and that's what we're going to use, but the Americans didn't. So guess what? The European results were the opposite of what the American results were. Well, golly gee, isn't that just interesting, right? Yet the Americans didn't want to say the Europeans were right. So back and forth for about 10 years until the Americans finally, not even an OBGYN, but an American cardiologist did a study that looked at the cardiovascular health and ramifications of women early and late postmenopausally being put on estradiol. And all he looked at was estradiol, okay? Not even the progesterone. But in the world of cardiac health, that is still the number one killer of women in this country. Okay, so it deserves to be looked at. So he did this study and then did a meta-analysis, meaning he looked at other studies besides his own. And guess what his conclusions were? He showed that there was a 32% reduction in coronary heart disease and a 39% reduction in all mortality, including cancer, when women take bioidentical estradiol.
Wow.
That is like groundbreaking. That is more significant than statins, which everybody in Western medicine pushes a statin on a patient, even if they just look crosswise at you. Oh, you must need a statin, you know?
Yeah.
And even statins don't give that kind of a percentage of increase in health. So why can't we measure hormone levels? What's the big secret? What is the harm if there's no foul and there's great benefit in checking hormone levels? Isn't that just a great question that I've not found any even medical school professor, even another medical school OBGYN head of department able to answer for me. So I felt so strongly that half of our population, women, are being medically ignored and not given the information that they should be getting, that I actually sat down and wrote these books. So I really feel, and there's another book coming yet, I still have the 20 to 40-year-old women's book coming, talking about the issues that other people may have talked about, but not like I will scientifically, meaning polycystic ovary disease and infertility, not just waiting until you can't get pregnant and then suddenly you find yourself in the infertility specialist's office and they're talking about $12,000 a cycle for IVF, and you're going, excuse me?
Yeah.
What? You mean, what?
Yeah. One more time.
Yeah, it's out of control. And women are simply told, deal with it, or worse, ignored, not given the information that they need to help them be as healthy as they can. And so it's our health. And yet we're asking for answers and nobody is giving us those answers. Now maybe they don't know the answers, but then shame on medicine for not doing the studies that look for where women's hormone balancing should be. Now, I've done those. So I have, for the past 15 to 20 years, have managed my patients scientifically according to the graphs that actually the Europeans have taught us about hormone balancing. And I keep my patients forever 20 years younger than their stated age.
Wow. Yeah.
So one last thing about ignoring women's health is there was a really, really, really fascinating chapter or story in the January 2020 National Geographic of all magazines. And its title was Why Women's Health Gets Shortchanged.
Yeah.
Amazing article that if you get a chance, look it up, January 2020 in National Geographic, Why Women's Healthcare Gets Shortchanged. Fascinating read, because a woman coming in with the same complaints is treated differently than a man coming in with those complaints.
Interesting.
Oh, it's beyond interesting. It is absolutely frightening and frustratingly angering is what it is. We are second-class citizens in the world of healthcare, and that needs to change.
Yeah.
Your mission to empower women about their health and to spread this knowledge is so admirable. Tell me, what would be some advice that you would give to someone starting out in your industry?
I would tell them to be true to medical research and to realize that medicine is not about you. It is not about the doctor. It is not about your schedule. It is not about the hospital you may work for. It is not about the pharmaceutical industry. It is about the patient. And the patient comes to you and they put their trust and their faith in you. And your job is to never stop learning and to always, if you don't know the answer, be the incessant 2-year-old and continue to ask why this is happening. Why is she having these symptoms? Why are we seeing this result? And be that inquisitive physician who never stops learning. Then you will be the best that you can be in your field.
That is absolutely beautiful advice. Vicki, throughout your illustrious career, you have won numerous awards, honors, and featured in magazines worldwide. This past year, I've heard that you were honored at IAOTP's annual awards gala at the Bellagio Hotel for your selection as Top Medical Director of the Year, and this year, receiving the Empowered Woman of the Year award. You were featured on the famous Reuters building in Times Square and were on the front cover of Tip magazine. Congratulations, that is quite amazing. What would you say has been the highlight of your career or most memorable experience that you've had to date?
Well, it actually just happened last fall, of all things. After being immersed in writing my books and getting my message out about women's health and empowering women about their own health care, I was approached by a new medical group called RHM, which stands for Regenerative Health Management or Maintenance, whichever word you want to use. To me, they're interchangeable. But RHM's mission is to deliver patient-centric medicine. Now, there's a concept, right? Wow.
Right.
And the word regenerative kind of begs the question, what do you mean regenerative? Well, it means giving the body the tools that it needs to help heal itself, because it knows how to do that, but it just needs the help in order to do that. So RHM was aware of my books and my emphasis on hormone balancing for best health, both men and women. And they approached me because they wanted my hormone balancing system as their wellness foundation and their medical approach to patients. So I was brought on board to be their national physician trainer so that we, with every patient seen coast to coast under this method, would have consistency in patient care. We would have the blood work and the ability to be scientific about our patients presenting with their symptoms. And now we are able to do research, because research is the best tool to show not only patients, but the entire medical community that there is science behind wellness and that we can keep people off of medication and out of the healthcare system, which they may or may not want that outcome. But that's what every patient wants. No patient walks into an office and says to their doctor, I want you to put me on medication and then take me to the operating room in about 6 months.
Yeah, no.
Who says that, right?
Yeah, nobody.
You go there to get off of medication and to get out of the healthcare system. So RHM is putting together the best and brightest medical minds so that we can help our patients achieve best health and wellness. And that my personal belief is that we can have healthy centenarians all across this country. We simply haven't been utilizing the science that we know is out there to teach our patients how to do this. And that's what RHM is all about.
Wow. They sound like an absolutely amazing national organization, and what an incredible honor to be approached by them and be working with them.
So when not working, I know that you have some hobbies. What do you like to do for fun?
Well, I'm a very water-oriented person, as is my family. So anything to do with water. We sail, we scuba dive, we taught all of our kids how to swim before they were 1 year old. They've been in water since they could, crawl. Yeah. And so anything around water. Yet we enjoy, as we live in Wisconsin, it's a 4-season state. So we enjoy our winter sports as much as we enjoy our summer sports.
Well, this time of year you must be particularly busy with your water sports.
Oh, and this has been a summer of summers. Even in Wisconsin, we're having this amazing summer. So we've been able to get out to Lake Michigan, which for those of you who don't know about the Great Lakes, Lake Michigan is this little itty-bitty puddle of a lake that's about 600 miles long and, and whatever, 100 and maybe 200 miles wide and 800 feet deep. So it's a huge body of water, and sailing and tubing and water skiing and scuba diving and all of that is available right on our doorstep, which is just phenomenal.
How fabulous. Looking back, what would you say that you attribute your success to?
Well, actually to my perseverance of what I believe in, which is patient-centric care, taking care of my patients the way I would want my own health to be taken care of.
Right.
So because, again, I don't want to be put on medication or operated on or told that there isn't an answer for what you have going on, then I don't want to be that doctor that doesn't have the answer. So, I myself have been medically misdiagnosed. I've actually died on the operating room table twice.
Oh my goodness.
Once because I was misdiagnosed and they caught it after a second team intervened while I was on the table. And the second time I was told that my pain wasn't real. And when they operated after I spiked the fever and my gangrene of my bowel ruptured on the operating room table and I died on the table the second time, then they told me afterwards, I guess your pain was real. And that was from a physician talking to a physician.
Wow.
Who didn't believe my pain was real. So I really, really strongly feel that patients deserve to be heard. It is not about the doctor's schedule. It's about the patient and why they come to see us. They are our customer. And if that customer doesn't walk through our door, then we have no business. And maybe we shouldn't have a business if that's the kind of doctor that we are. So I fully intend to put the science back into medicine, especially women's health, and I fully intend to change the face of women's health and to put the patient back into patient-centric medical care.
Your mission is so important, and we are so lucky to have you doing the work that you do. Thank you so much for joining us today, Dr. Mondloch. We are very honored to have you as a guest.
Well, and thank you for spending the time with me today. So help me get this word out about women's health. And, for every listener out there, if this sounded at least remotely interesting or sounded like somebody needs to hear this message, then go to Amazon and purchase Blossoming for the Adolescent in your life or in your family, or purchase Full Bloom for that perimenopausal, menopausal, or beyond woman. And maybe it's for you, but help me empower women, help me spread this knowledge of women's health, and let's change the face of women's health together.
And please, for more information on Dr. Victoria Mondloch, you can visit her page on LinkedIn or at www.IAOTP.com's website.